Have you ever found yourself curious about intimate choices that feel difficult to discuss openly? Questions about what draws people toward certain experiences, what shapes those decisions, and whether those choices come from genuine desire or something else entirely. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your sexual health or intimate well-being, stay with us. We're here to help you understand your body with clarity, comfort, and without judgment. Today, we're going to explore a topic that's both widely practiced and rarely discussed with honesty: why women choose to engage in anal intercourse. We'll look at what the research tells us, what women themselves have shared about their experiences, and what all of this means for communication, consent, and pleasure in intimate relationships. Let's start with what we know. Over the past few decades, participation in anal intercourse among heterosexual couples has become increasingly common. Yet despite this shift, there's surprisingly little open conversation about why women choose to engage in it. Is it because of what they see portrayed in media or adult content? Is it about fulfilling a partner's expectations? Or is it truly about their own pleasure and curiosity? These are important questions because intimate choices should always come from a place of informed consent, mutual respect, and genuine comfort. When we don't talk openly about these experiences, we leave room for misunderstanding, pressure, and sometimes even harm. Back in 2014, a group of researchers decided to explore this question directly. They wanted to understand women's lived experiences and perceptions when it came to anal sex. Now, in their study, they specifically defined anal sex as penile anal penetration, not other forms of anal stimulation like oral or manual touch. The researchers conducted 4 focus groups involving a total of 32 women from diverse ethnic backgrounds. These women were recruited from 2 different settings: an outpatient substance use treatment program and a community-based STI testing clinic. To participate, women had to report having engaged in anal intercourse with a male partner and also have a history of illicit drug use. Now, you might be wondering why drug use was part of the criteria. My sense is that the researchers wanted to explore whether substance use played a role in these intimate decisions, whether women were more likely to engage in anal sex while under the influence, and whether that influenced their experience or their ability to consent freely. The researchers asked women about the frequency of anal intercourse in their lifetime and with recent partners. They asked whether these encounters involved new, casual, or long-term partners. They explored whether alcohol or drugs were present during these experiences, and they asked about practical details like the use of lubricant, preparation, and setting. What they discovered was both illuminating and concerning. The study identified 6 main reasons that women gave for engaging in anal intercourse, and not all of them reflected choice, comfort, or pleasure. Let's walk through what these women shared, because each reason tells us something important about consent, communication, and the complexity of intimate decision-making. First, being under the influence. A significant number of women reported engaging in anal intercourse while high or intoxicated. In fact, 62% of the women in this study said they were under the influence of substances at the time of the encounter. Now, that statistic should give us pause. When someone is intoxicated, their ability to give clear, informed consent is compromised. They may agree to things they wouldn't otherwise choose. They may not fully process what's happening or advocate for their own comfort and safety. This isn't about judgment. It's about recognizing that substances can cloud decision-making in ways that affect intimate experiences. Second, personal desire. Some women did engage in anal intercourse because they genuinely wanted to. They found pleasure in it. They were curious about it. They felt comfortable exploring it with a trusted partner. This is an entirely valid reason. When people engage in any intimate act from a place of genuine interest and informed consent, that's a healthy part of sexual exploration. But it's important to note that even among the women who enjoyed anal sex, the majority still preferred vaginal intercourse. Anal sex, for many, was something they enjoyed occasionally or with specific partners, not a primary preference. Third, pleasing a partner. Many women said they engaged in anal intercourse because they wanted to fulfill their partner's desires or meet their expectations. Sometimes this came from a place of love and generosity. Other times it came from pressure, spoken or unspoken. Now, there's nothing wrong with wanting to please your partner. Intimacy often involves giving and receiving in ways that bring joy to both people. But when pleasing a partner becomes the only reason for doing something, especially something that may be uncomfortable or unwanted, that's where we need to pause and ask, is this truly consensual? Is this truly mutual? Fourth, avoiding vaginal sex. Some women chose anal intercourse as an alternative to vaginal sex for practical reasons. They might have been menstruating and wanted to avoid vaginal penetration during that time. They might have been trying to prevent pregnancy and saw anal sex as a way to engage intimately without that risk. Again, this is a choice that some women make consciously. But it's worth noting that this reason doesn't necessarily reflect a desire for anal sex itself. It's more about avoiding something else. And that distinction matters when we think about pleasure, comfort, and genuine consent. Fifth, quid pro quo situations. This one is harder to hear, but it's important. Some women in the study reported engaging in anal intercourse in exchange for money, drugs, or other resources. This reflects a reality for some women in vulnerable situations, where intimate acts become transactional out of necessity or survival. It's a reminder that not all intimate choices happen in the context of safety, equality, or true consent. Sixth, lack of explicit consent or coercion. Perhaps the most troubling finding was that 53% of women in the study described situations where they engaged in anal intercourse, even though they didn't want to. They felt they couldn't say no. They didn't know they were allowed to refuse. Or, in some cases, they were explicitly coerced or forced. This is not consent. This is not intimacy. This is harm. And it's a stark reminder that we need to talk more openly about what consent really looks like. Not just the absence of a no, but the presence of an enthusiastic, informed, and freely given yes. Let's go a little deeper into what these women described, because the details matter. Many women said their partners expressed interest in anal sex because they wanted to try something new, something exciting, something that felt exotic or adventurous. Some partners framed it as a special experience they wanted to share. Others presented it as something they expected. Interestingly, some women described anal intercourse as something they would only do with a special partner or at a special time, almost like a gift reserved for someone they trusted deeply. Among the women who did enjoy anal sex, there was a clear pattern. Pleasure was closely tied to preparation, communication, and care. They talked about the absolute importance of using plenty of lubricant. They emphasized going slow. They described partners who checked in, who listened, who prioritized their comfort. But on the flip side, women who had partners who were self-centered, inexperienced, or careless almost always described the experience as painful. Some felt emotionally humiliated, some felt used, and many wished they had felt empowered to stop the encounter or refuse it altogether. This tells us something crucial. The experience of anal sex, whether it's pleasurable or painful, whether it's empowering or traumatic, has everything to do with communication, respect, and mutual care. So what can we take away from this study? First, let's be clear, this was a small study focused on a specific group of women who also had a history of substance use, so we can't generalize these findings to every woman or every situation. But I would argue that, aside from the high rates of substance use during these encounters, many of these experiences are probably quite common. If you're someone who is considering engaging in anal sex, or if you're in a relationship where this has come up, here's what I want you to know. If you're the person receiving anal penetration, you have every right to say no. You have every right to set boundaries. You have every right to stop at any time if something doesn't feel right. If you do want to try it, communicate openly with your partner. Talk about what you're comfortable with. Talk about what you need to feel safe. And don't be afraid to speak up if something hurts or feels wrong. Never continue if it's painful. Pain is your body's way of telling you that something isn't right, and no intimate act should come at the cost of your physical or emotional well-being. If you're the person initiating or giving anal penetration, communication is everything. Ask your partner what they want. Ask what they need to feel comfortable. Check in throughout the experience. Go slow. Use plenty of lubricant, more than you think you need. The anus doesn't self-lubricate the way the vagina does, so external lubricant is absolutely essential. Prepare your partner. This might mean starting with smaller forms of anal stimulation, using fingers or toys, and building up gradually over time. Rushing into anal penetration can cause pain, injury, and lasting discomfort. Respect their boundaries. If they say no, or if they ask you to stop, honor that immediately. Consent isn't just about the beginning of an encounter, it's ongoing throughout. For everyone, always use condoms during anal sex. The tissue inside the anus is delicate and more prone to tearing than vaginal tissue, which increases the risk of sexually transmitted infections. Protection is non-negotiable. If you want more detailed guidance on how to engage in anal sex safely and comfortably, I encourage you to check out my other videos on this topic. I've also covered FDA-approved condoms specifically designed for anal sex, which can make a real difference in safety and comfort. Here's what I want you to remember. Intimacy, whether it involves vaginal sex, anal sex, or anything else, should always be rooted in respect, communication, and genuine consent. It should feel like something you're choosing freely, not something you're enduring or giving into. If you've ever felt pressured, coerced, or uncomfortable during an intimate experience, please know that your feelings are valid. You deserve better. You deserve care. And you deserve partners who see your comfort and pleasure as just as important as their own. And if you're navigating questions about your sexual health, your boundaries, or your experiences, please don't hesitate to reach out to a trusted healthcare provider. These conversations can be vulnerable, but they're so important, and you deserve support that's compassionate, informed, and free of judgment. Thank you so much for being here today. If this video helped you, please share it with someone who might need to hear it. Subscribe so we can continue these honest, important conversations together. And as always, remember to take care of yourself because you're worth it.